right, you guys, it's summertime and these kids are rambunctious. They're all over the place. Lots of opportunities for cuts, bruising, scrapes. Brenda Freymiller is here from LDS Hospital. She's from the Wound Care Clinic, and we're so happy to have you here because you're going to give us some tips on what to do if our children have little scrapes and cuts, right?
Right.
Okay, so what's the first thing? This is my question. I always want to know, what should I have on hand at home? Like, what things should I always have?
So, good things to have on hand, a good antibiotic ointment.
Okay.
Bacitracin's it's a good one. It's got a zinc. It stays moist.
Wait, which one is it?
The bacitracin ointment.
Oh, okay.
In the front.
Okay, got it.
You want something that's going to stay moist. We always think of scabs as good things, but scabs actually tighten things. It dries it out. It doesn't heal as well, and it can leave more scarring.
Okay, so you actually don't want it to scab.
So we actually don't like scabs.
Oh,
so
okay.
We really encourage people to, you want to get it clean. If there's any bleeding, get the bleeding stopped. If you can't get the bleeding stopped, you'd want to go in and get that looked at Instacare or an emergency room. But just take a few minutes, a little pressure on any bleeding areas, clean it. Sometimes that might include just if it's a bigger area, soaking it with a cloth, maybe even getting in a tub or just a lukewarm shower just to kind of clean it. The tweezers can help get any debris out if you've got any rocks or stones or anything from falling. Get that kind of cleaned up. Put the bacitracin or put the ointment on it, and then cover it with like a nonstick pad. These Curad like nonstick pads, they have a layer on them that keeps it from sticking to it, so when you take it off, it doesn't hurt. That with the ointment just help keep everything moist, keep it covered. Band-Aids are great for small areas.
And for small children. I'll tell you, in my house, usually a kiss and a superhero Band-Aid makes all better. I don't know if that's really the healthiest thing for them. When you're getting a Band-Aid, is there something specific you need to be looking for?
Not really, just something that you know is going to stay on well. Some are stickier than others, you know. But as far as you wouldn't have to buy the ones with the antibiotic already in them if you have a good antibiotic ointment that you can just reapply.
Did those really work? Are those as effective, the ones that have it? Antibiotic?
They can be.
Okay.
I like the ointment better because you have better control over getting it where you want it and making sure it stays moist.
Okay, let me ask you this. How much ointment do you actually need? I feel like sometimes I get a little crazy with the ointment.
Yeah, you can't stick the Band-Aid on mine because there's a lot of ointment.
Yes, how much do you actually need?
You know, maybe like a dime-sized thickness. It isn't a lot, but you just want enough to keep it moist and keep it from drying out.
And then how often should you change?
At least once a day, probably, especially with kids because they're in and out of things. And that's where, what I like about this is like for an arm or a hand or even a leg, it sticks to itself. So if your Band-Aids keep falling off because they're getting into something, you can put your pad on and you can use this and kind of loosely wrap it around because it'll stick to itself and it won't be pulling off tape.
Well, now, if that gets wet, does it still work? Okay.
Yeah. It's just if the bandage gets really wet, you probably want to change it.
Yeah.
And what I think is so important is you have up here these gloves. Never have I used a glove to put on in that emergency situation when my kid's so sad. But it is very important to have clean hands.
It is have clean hands. So the gloves, if you want to, you can wear those. But as long as you're washing your hands really well, good. Sing happy birthday, soap and water, washing your hands. With a good suds, you'll clean off what you need to. And I mean, you and your family, you're all used to each other's germs, so you can and the blood, so you can go gloveless.
Let me ask you this: do you have any tricks for when the kids are so young and they get hurt, and you're cleaning off the wound and they're freaking out and it hurts? I mean, do you just pin them down and do it? And just take care of it? How,
restraint.
I mean, it's important to really get that taken care of immediately.
It is important to take care of that. Sometimes what I do, even with some of my older people, is if it's a really painful area, I have them help. If they will. If it's the tape is really stuck and they don't want you to peel it off, sometimes if they participate in it, it takes a little of the anxiety away. There's a little more control.
Okay. Well, one last question for you. I want to know, when can you not treat it at home? When do you need to be coming into the wound center?
If you can't get the bleeding stopped, and again, just hold pressure for a couple minutes, and if it's still just bleeding and you can't get a stop, it'd be a good time to go to Instacare emergency room. And then later on, if the pain is just not getting better, if it's starting to increase in pain, if it's starting to swell, redness, any fevers, chills, any signs of infections like that, you want to make sure that you go in.
These are great tips. I mean, this is something that we all need to think about, because it's like when it happens, you're not prepared, and then you're like, oh, I wish I would have known all this. So I feel like we should all go and buy all this stuff and just have it on hand. Brenda, thank you so much. And for more information, you can go to ldshospital.org or give them a call at 801-408-1100. Brenda, thank you.
Yeah, thank you.
Yeah, thank you so much for being here, and you're going to want to stick around, because when we come back, my prayers have been answered.